I've heard your passion today, and I'm inspired by the dedication of CAW members to both international and local causes in equal measure, and for your commitment to social justice around the world. You have again shown your solidarity through your most recent donation to our work in Syria. Again, we work in close to 70 countries around the world to provide aid to people affected by war and conflict, epidemics, and both natural and man-made disasters. We save lives, we alleviate suffering, and we restore dignity. Medicine is our tool and our point of access as humanitarians. We're motivated by that humanitarian impulse that connects us all and compels us to help others who are suffering. So to put this work in context, Syria is surrounded by 4 countries, Turkey, Lebanon, Iraq, and Jordan. We're responding in all 4 countries, providing assistance to refugees. Since the start of the conflict, roughly 57% of public hospitals have been damaged and 36% are no longer functioning. But this number does not include makeshift hospitals and clinics set up by local NGOs and solidarity networks. So in terms of humanitarian toll, overall the UN has reported that 70,000 people have died as a direct result of this conflict. Civilians have been traumatized and live in constant fear of gunfire, rockets, and missiles. According to the UNHCR, 2.5 million Syrians have been displaced inside the country since the protests broke out. Since MSF has been denied the ability to work in areas controlled by the government, we can only provide direct assistance and deploy our teams in rebel-controlled areas. Very few other aid organizations are present, which is severely limiting access to healthcare. MSF's main activity in Syria is trauma, so both life and limb-saving surgery, where we treat direct victims of the conflict, people wounded by gunshots or explosions, shelling, and shrapnel. We've started running outpatient clinics that enable us to identify and meet other needs, such as care for chronic diseases, primary health care consultations, and maternal care. In the regions where MSF has been working, children have not received vaccinations for the last 18 months. So children under 2, which were essentially born since the conflict broke out, are particularly vulnerable to disease. Just to summarize our response to all these massive needs, through our field hospitals within Syria, one of which was first set up in a cave, another on an evacuation route for the war wounded, MSF has performed 1,500 surgical procedures and more than 20,000 outpatient and emergency consultations between June 2012 and February 2013. In neighboring countries, MSF is doing reconstructive surgery for the war wounded, mental health, primary health care, prenatal care, and providing treatment for chronic illnesses. Our teams regularly carry out ad hoc distributions of relief supplies, including hygiene kits, stoves, coal, infant formula, and flour. We've installed piped water, latrines, and bucket chlorination to improve water and sanitation conditions and to prevent the spread of disease and other infections. We've also distributed and donated supplies to field hospitals and clinics within Syria, including in government-controlled areas. We do our best to work on both sides of a conflict, no matter how politicized the situation may be. In terms of training, wherever we work, we do our best to build local capacity. So long after our teams have left, there is some medical expertise. MSF is providing training in anesthesia, use of surgical kits, and mass casualty management. However, because so many Syrian healthcare workers have fled, this sometimes means training local dentists, pharmacists, and many youth, all wanting to contribute whatever they can to the relief efforts. By all accounts, the humanitarian situation for Syrians will unfortunately get worse before it gets better. In response to these growing needs, we have doubled our budget for Syria over the last 2 months, and we're looking to double the number of medical centers again over the next 6 months. Despite these overwhelming needs, we're doing our best. In addition to the medical action, the importance of our work often comes down to us simply being there to show our solidarity. Thank you for your time today and for your generous support.